Hi everyone, I am Dr. Abhishek Mishra. I am a senior consultant in Orthopaedic Joint Replacement, Spine and Arthroscopy. I have an experience of more than 20 years and I have done more than thousands of surgeries related to orthopedics, joint replacement, spine and arthroscopy. So today here I am there to talk to you briefly about a surgery called total hip replacement. So when the patient needs a bilateral hip replacement is usually needed in younger patients who have had like avascular necrosis or secondary osteoarthritis due to avascular necrosis or rheumatoid arthritis. So generally these patients, both the sides are affected because of the systemic disorder which they had or because of avascular necrosis they had. Avascular necrosis is again a very common condition. Avascular necrosis, it basically means avascular means loss of blood supply and necrosis means death. So basically what happens, somehow the blood supply to the head of femur is cut off and gradually the head of femur, which has gotten devoid of blood supply, becomes deformed and it doesn't remain as rounded or smooth as it should be. It starts giving pain to the patient starts a limp, the ambulation, walking, everything becomes difficult for the patient. And with time, within a couple of months to a few years, patient develops secondary osteoarthritis. So such patients usually at a very young age, they need a total hip replacement, and many a times, I would say approximately 50% of times, these young patients, if they have had any of these conditions, they would need a bilateral total hip replacement. So honestly, I feel a bilateral hip replacement, if actually the patient needs it for both the sides, should be done in one go so as to reduce the convalescence time or recovery time of the patient. Thank you very much.